Our last intervention that we have set up for today is some rhythmic rotation, which we're going to use a yoga ball, and this is something your wife can actually assist you with because we don't want you to actively contract those muscles that are currently in a rigid state or the tightened state. So we want to do this for the dissociation point, which dissociation is going to be the separation of movement between body segments. So that's going to be helping your abdomen work separate from your legs. Now, the goal again is just for decreasing the rigidity and increasing that segment movement. So for this, we're going to be laying flat on your back with your feet elevated and knees bent at 90 degrees, which I will demonstrate that position. We're going to be in that position primarily due to having a yoga ball, which that'll be in clinic. At home, your wife can do it, and I will also demonstrate how she can do it at home for a second option. And I'll demonstrate those body location areas as well. So what we want to avoid is any active muscle contraction, so really don't be using those muscles in your abdomen and legs to move. And what we do want is for you to honestly not really be thinking about what we're doing at all, being in mid-conversation and being distracted while passive movement, so myself or your wife is moving your legs for you to help get that motion separation. Reasons to stop, if again, shortness of breath, dizziness, increased heart rate, those are the general things to stop. Just in case if you're having issues with like your blood pressure, and then if there's any other symptoms that you notice that is abnormal for you, just let us know, any pain, anything like that. So I'm going to demonstrate that position and what we need to do there. So for this, we're going to be laying on your back. So your back is going to be flat on the table or the mattress, wherever you are located. Shoulders back, head up. So you're going to be kind of that proper body position that we was talking about earlier with the standing. Then your hips are going to be flat on the table. Knees bent and feet flat. And this would be probably the position that you would want at home with your wife. Then here in the clinic, if we're using the yoga ball, we would have a ball supported underneath our legs and be in this position. From here, with assistance, someone will hold on to your legs, and while you're mid-discussion, not really paying attention to what's going on, they're just going to slowly rock your legs back and forth without any assistance of your muscle contractions. And we'll do that for 2 to 3 minutes to help really get that motion broke apart and get your trunk separated from your limbs so you have better mobility. So again, we're going to lay here with support from someone. You're going to be passively moved, legs one direction, legs the other direction. And then for our final demo, we don't want you looking up or anything. We, again, want your head down in a relaxed state. Just moving with the movement rather than activating the movement. And you can do that at home on your bed, so that way you have room to go both directions. And that finishes up our treatment for today, both the independent mobility with varying surfaces, the standing dynamic balance exercises, reaching out a base of support with both arms and legs, and using rhythmic rotation for that dissociation. Thank you for letting me treat you today, and thank you for your wife for letting me educate her on how to appropriately assist you through those interventions. And if you have any questions or concerns, you can ask myself. If it's something I cannot answer, I can guide that to either your PT or someone such as your doctor. And if you have any questions or concerns that I cannot answer, you can also directly contact them. Thank you.